Despite significant developments in treatment and preventative equipment over the last few decades, malaria is still a serious issue that affects communities all over the world. According to the latest World Malaria Report published by the World Health Organization in December 2019, there were 228 million cases of malaria reported worldwide in 2018.
The report shows there were 405,000 malaria deaths in 2019. The African region accounted for 94% of these deaths, the majority of which were pregnant women and children under the age of 5. There has been a resurgence of malaria cases in the highland regions, where altitude previously deterred mosquitoes. 1 in 5 residents of East Africa, or 125 million people, live in the highland areas susceptible to malaria epidemics. During malaria epidemics in East African highlands, the disease can infect up to 60% of a village population, overwhelming local health workers.
This is the systems map for the town of Kericho, an East Highland town in Kenya that drives most of the country's tea production and contributes to Kenya's ranking as one of the largest tea producers in the world. Most of the population works in the tea plantations. Unfortunately, it has recently experienced a surge of malaria cases and increased malaria mortality in the last couple of years due to several drivers, threatening the health of the population and the economic stability of the town. Environmental drivers such as temperature can significantly impact disease transmission, particularly that of vector-borne diseases such as malaria. Previously, Kericho had been somewhat protected from malaria because of its high altitude and low temperatures. However, because of environmental drivers such as climate change, average temperatures have increased steadily above 16 degrees Celsius in the region. The rising temperature above 16 degrees Celsius allows for an environment better suited for malaria-vectoring mosquitoes to breed and survive. This increases the chances for residents to come in contact with malaria-vectoring mosquitoes, contract malaria, and potentially die. Human movement can also drive the increase in malaria cases and mortality in a region. There has been a substantial increase in human movement between the lowlands and Kericho in recent years, with malaria being more prevalent in the lowlands because of more favorable conditions. Those who are infected with malaria that travel to Kericho come into contact with the native mosquito species. These mosquitoes, which now carry malaria, can then go on to infect the residents of Kericho, resulting in an increased number of malaria cases and mortality. Socioeconomic factors play a large role in increased malaria mortality. Because of decreased government funding and the sudden onset of malaria in the region, Kericho lacks malaria infrastructure and supplies that effectively tackle diagnosis and treatment. This is seen in the lack of diagnostic tests available to residents to confirm the diagnosis of malaria. Without enough diagnostic tests, residents are not aware they have malaria and only discover they do when they present with advanced symptoms. This increases their odds of succumbing to the disease. The ability of diagnostic tests could allow several people to detect malaria in its early stages and minimize the risk of death and self-medication. It is an area that we can tackle in this complex grand challenge of malaria mortality. We align ourselves with WHO's mission to reduce mortality associated with malaria, especially among pregnant women in Africa. We aim to decrease both the number of malaria cases and the mortality rate, starting in Kericho, and then expand our efforts to other malaria communities in Africa if we are successful.
Our proposed solution is to increase the distribution of at-home malaria rapid diagnostic tests to communities in Kericho. These tests work very quickly and are specific to the strain of malaria. You simply put your blood sample in the provided buffer in their respective slots, and then wait for your results to show in the display area. This conveniently allows for the diagnosis of malaria in households without the need for much medical intervention. These tests are ideal for several reasons. For one, they are simple to perform, and limited training is required after instruction on usage is given. The results present in about 15 minutes, making it quick. It is also fairly accurate in detecting very low plasmodium levels in people, making it a good test to catch malaria in its early stages. At just $1 per test, large-scale distribution is very affordable. As Kericho is in a remote region, individuals testing positive experiencing more mild symptoms will be encouraged to go to their local community health workers to be treated. Here, community health workers will encourage people to undergo appropriate treatment, not to self-medicate, in order to avoid the development of drug resistance. If people experience a more severe case of malaria, they will be encouraged to go to larger hospitals or clinics to be treated. This ensures that appropriate treatments and interventions will be available. Our solution is not intended for people to self-treat or self-medicate. Rather, it allows them the opportunity to get an early diagnosis and seek out appropriate treatment. In doing this, we help prevent drug resistance to malaria and promote effective early treatment, thus decreasing malaria transmission and mortality. Rapid diagnostic tests give people the opportunity to detect and diagnose their symptoms early. This will allow malaria cases to be detected before serious symptoms arise, allowing for people to seek out treatment early. By encouraging citizens to conveniently utilize the rapid diagnostic tests at early signs of malaria and pursue appropriate follow-up procedures, we prevent the malaria plasmodium load from increasing too high to an untreatable load. Additionally, we encourage the usage of treatments from health clinics rather than self-medicating to prevent malaria drug resistance. By seeking out treatment early and minimizing the likelihood of serious symptoms through early treatment, we hope that this will decrease both the transmission and the mortality of malaria, in addition to providing additional infrastructure for Kericho to tackle malaria. The first main goal and our primary objective in using the rapid diagnostic tests is to lower the mortality rate for malaria in the East African Highlands in Kericho. This will give us an idea as to whether our solution has been directly successful as we had intended. We also want our solution to incentivize other methods of detecting malaria earlier, so that people experience milder symptoms and ultimately do not die as frequently from the disease. Our stretch goal is to reduce mortality associated with malaria across Africa. At this point, we would have distributed rapid diagnostic tests to many towns across Africa. We want to particularly focus on pregnant women and young children, as they are the most vulnerable.
The implementation of the RDTs will involve international organizations like the World Health Organization and the International Children's Emergency Fund, who will facilitate product distribution. The two institutions will take the product to Kenya. The Kenyan national and county government will be responsible for distribution and sensitization in Kericho. Additionally, the governments will be responsible for providing training. Research institutions such as the International Center for Insect Physiology and Ecology, the Kenya Medical Research Institution, and the University of Nairobi will be involved in training of the product usage. The research institutions will also be involved in the monitoring and analysis of the product after distribution.
So, how do we know our efforts are making a difference? We can monitor pertinent areas that would show how our strategies are impacting our malarial infection rates and cases in 3 ways. Our first area is to increase our public awareness about RDTs through public demonstration and workshops in order to get community members trained in using the test independently in their own homes. Additionally, proper training and supervision from community health workers stationed in rural communities, as well as fellow facility nurses and doctors in the clinic, will be ensured through required training modules for both healthcare workers and the test distributors. The second area of focus is to ensure optimal quality of the test. In order to make sure that our RDTs are working correctly, we would establish that our RDTs are being stored properly, as well as having weekly check-ins via blood smear comparisons and centralized staining in order to confirm our RDT accuracy. While false testing results are rare, we must account for it and try to combat any potential inaccurate results. And finally, the data collection. Throughout this entire process, we would work hand in hand with other organizations like WHO and UNICEF in their malarial data case studies collection. We would give these organizations more specific data from the African highlands. Through this, we will be able to find the total proportion of our disease that leads people in infected areas to seek treatment, either from community health workers in nearby facilities and clinics. Also, during these check-ins, we would provide supplies as needed during these monitoring and work with those manufacturers such as JSK, PATH, WHO, or UNICEF to see how our efforts are panning out. These check-ins will also provide more community and organizational involvement that will facilitate increased commitment from all stakeholders involved. The introduction of the self-testing kits might increase its popularity among shop vendors and increase revenue for their businesses overall. States will also benefit from the test because more healthy people will be able to work for them. The population may also find new sources of income from these different businesses as well from participating in community outreach and assessment of the kits. This increased uses of these diagnostic kits could also decrease the number of medical center visits for malaria-related illnesses, as well as individuals would receive treatments earlier and not require hospitalization. This therefore reduces the stress on hospital resources and saves money for the medical centers. There are, however, some unintended outcomes that may occur. International organizations have a large role in facilitating malaria research and the development/distribution of RDT. Because of this, CARICO will have increased dependence on these organizations regarding malaria and future research opportunities. Additionally, the accuracy of the diagnostic kits is less than an official diagnosis, and misdiagnoses can lead to negative outcomes, both for false positive and false negative. Further, data on malaria prevalence/outbreak might be lost as many cases may go unreported to the mandated institutions if they self-test or treat themselves.